here on the eyes and on our heart. Now we go down a little bit, okay? We go down to our knees, okay? So, many suffer wear and tear to their knees, hips, and joints. This scenario is more pronounced as we age, causing many to feel pain and reduce their physical activities. However, we all need to exercise regularly in order to keep ourselves healthy and physically active. How can we minimize and prevent further degeneration to the joints and yet maintain an active lifestyle? Let us find out now from Dr. Choon, a bone specialist orthopedic surgeon from AP Center for Joint Reconstruction. Dr. Choon was awarded the Public Service Commission Merit Scholarship to study medicine in University of Singapore, where he graduated at the top of the class. He was awarded the Howard Eddy Medal by the Royal Australian College of Surgeons for topping the FRACS examination and did his fellowship at the Royal College of Surgeons in Edinburgh. He was accepted by the Mayo Clinic, USA, to train in adult reconstruction and joint replacement surgery, tumor surgery, biomechanics, and bone physiology from 1988 to 1989 under the Health Manpower Development Plan. There, he was subsequently appointed as an adult reconstruction fellow, Department of Orthopaedics from 1989 to 1990, to specialize in hip, knee, shoulder, and elbow primary and revision replacement surgery. He held a concurrent appointment as instructor, Mayo Medical School during his fellowship. In Singapore, he served as a senior consultant in Tan Tock Seng Hospital, as director and senior consultant in Adult Reconstruction Service, Department of Orthopedic Surgery, developing the subspecialty of adult reconstructive surgery and training orthopedic and joint replacement surgeons from Singapore, China, India, and other ASEAN countries. He was elected president of Singapore Orthopaedic Association in 2007 and founded the ASEAN Arthroplasty Association for the arthroplasty surgeons of Singapore, Malaysia, Thailand, Philippines, Indonesia, and Vietnam, and served as the founding president. So please, let's put our hands together to welcome Dr. Lai.
Okay, thank you. Thank you for the kind introduction. I'm Dr. Lai. I just give you a little background myself. I was born and bred in Singapore, just like Joseph Schooling. So I'm not a foreign talent, but I trained in the USA at the Mayo Clinic in adult reconstruction surgery. Now, of course, you'll be asking me what is adult reconstructive surgery. Well, this is what I do. Basically, we do hip replacements, knee replacement, elbow replacement, shoulder replacement. In other words, basically in adult reconstruction surgery, we deal with that branch of orthopedics that deal with, joint pains, arthritis and, the hip, knee, shoulder, and elbow. So this is adult reconstruction surgery. You reconstruct the joints. So this is where I was trained for 2 years at the Mayo Clinic. And after I returned, I worked in Tan Tock Seng, I think for a good about 20 years or so. Some of you may know me there. And I, was a director and a senior consultant in the department. So, about 3 years ago, I moved over to, my own practice in Mount Elizabeth, Novena Hospital and Specialist Center. And today's topic is something I'm sure a lot of us have a lot of interest, mainly because of our Joseph Schooling winning the Olympics. All right, so, everybody wants to swim, run, and jump, and so on. And even in the older population like yourself, I see, some of you are represented up here in the, running and so on, jogging, and also someone to be, like Joseph Schooling, in the pool as well as cycling. We now know that the government wants us to have a car-light society, so, there will be, advances in places to cycle. So, but we notice here, this is our great hero, Michael Phelps, the greatest Olympian in the world. They say that he has won more gold medals than 175 countries put all together. You know, but you notice here that he has this cupping patch on his shoulder. All right, that means he has pain. That's why he went to see a Chinese sensei, probably in a Chinatown. And you can see all his cupping marks. And this is a lady swimmer with all the cupping marks on the back. In other words, Olympic style, caliber swimmers and athletes also will get pain and so on. So in other words, we are not alone, okay? We are not alone. So, and of course, in sports, sometimes it's not just aches and pains, but sometimes there are severe injuries like, football, cycling, running, or even playing tennis. I'm sure some of you all play tennis or badminton. You can injure your knee in the process. So what happens when we exercise? Well, we are putting a lot of stress on the hip and knee, and we basically know from biomechanics that when we walk, there's actually 3 times your body weight stress that goes through the joints. And when we run, because the velocity is higher, it becomes 6 times the stress that goes through the joints. So what happens? So this is our joint for anatomy. The joints, the one on the left is the knee, the one on the right is the hip joint. This is the normal structure. But when you pound on it, when you exercise and jump and run, well, you can injure your cartilage. Like over here, you see the knee cartilage is broken off. Or you can tear the soft tissue, the shock absorber, which we call the meniscus. You can tear that as well. In a younger person, you take more force. In the older person, because of degeneration, it is more easily injured as compared to a young person. And this is in the hip. Likewise, the same kind of injuries, except in the hip. I'm sure a lot of you must have known about it as, for the older ladies especially, postmenopausal women, they run the risk of getting a fracture in the hip joint because of osteoporosis. So the question we want to ask ourselves is, the older population, they are more or less at risk for injuries when they participate in sports and an active lifestyle. So what happens when we grow older? Well, basically, we all know we lose calcium in the bones, and they become osteopenic, then osteoporotic, and they are more easily broken. Then the other thing is on the other side of the joints, the cartilage, the meniscus, the ligaments, they degenerate, and they're much more easier to be damaged. It's requiring less force to be damaged and compared to a younger person. And then, of course, we know that when you're older, your balance is not so good. The muscle strength is weakened, coordination, vision, hearing is diminished. So therefore, you're more likely to fall and injure yourself as compared when you're 20 years old. So these are the injuries. You get sprains, strains, and then muscle injuries, joint injuries, and of course, fractures. So this is what we talk about when we say osteoarthritis. What is actually in the joint? Well, this is a patient of mine with osteoarthritis. You can see, let me go back. You can see that on one side, the cartilage is worn out, it's reddish in color, and it's, it's gone. And then this is in moderate arthritis. When they delay and they suffer and they persist in pain, and this is what you get, people with severe bow-legged ankles and a lot of pain because arthritis is severe. And then when we open up his knee joint, that's how bad it looks like. You can see it's completely destroyed. It looks like the crater on the moon, all right? It doesn't look like a healthy joint at all. And that's the reason why you have so much pain and stiffness. So what are the signs and symptoms of arthritis? It starts with pain, all right? Then you have the joints are stiff, and you notice that the joint, like for example, the knee or the fingers, they get swollen, and you start to limp. When you're limited in activity, for example, like, you can't climb staircase so easily, you cannot squat down, or you cannot walk fast. You've got to walk slowly now compared to before. And of course, the obvious deformity, either bow-legged or knock knee. So what can we do? How do you protect ourselves? Well, first of all, lose weight, all right, number one. Number two, change. I'm sure the cardiologist tells you to run and jump and so on. Well, it's good for your heart, but I'm sad to say, thank goodness he's not here. I'm sad to say is that it's not going to help your hips and knees because you're going to load it. So when we are older, we should change from high impact aerobics like running into, like walking and swimming and so on, or cycling when they're low impact. Avoid staircase if you can help it. Avoid squatting, all right? And then swimming is good, cycling is good, and walking is good because these are low impact activity. They're not high impact. They're not so damaging to your joints and hip and knees. So how do we treat? In other words, besides preventing, how do we treat a person when he has arthritis? Of course, we tell them, weight reduction is important. I'll tell you why. Physiotherapy, medication, and surgery. And I'll go through one by one in order so that you know how to look after yourself and, what stage you are in. So, as we said earlier on, when we walk, it's actually 3 times your body weight. When you run, it is 6 times your body weight. And that's why we consider weight reduction very important. Imagine that we need to walk to be healthy according to your Android phone, your smartphone. To be healthy, you need to walk 10,000 steps a day, all right? Imagine if you think, oh, I'm only 5 kg overweight or 10 kg overweight. Supposing you're 10 kg overweight, you're talking about 10 times 10,000 steps a day. So you're talking about 10 times 10,000, overloading in each joint. So for every pound that you're overweight, it actually is multiplied upon your joints by 3 times if you walk or 6 times if you run, and it depends on the number of steps you need to take to keep your heart in good condition, right? So weight reduction is very important. Now, physiotherapy is important because we know that when we get older and so on, the muscles shrink and the muscle bulk is gone, so you need to exercise to get them back. When you have a lot of pain, you can't do it yourself. You need someone, a trained person to help you with physiotherapy. And we know that when you have arthritis, the joint becomes stiff. So you need to move it to get it, flexible so they can do more things. And then, of course, there's heat treatment, there's shortwave, ultrasound. And of course, last but not least, do not look down on the walking aid. I know ladies, I treat a lot of old ladies, they do not like to carry a cane because it is bad. It is socially not acceptable, but it's all right to carry an umbrella. So for ladies, that's a tip. Carry an umbrella because it's going to rain or you don't like the sun, not because you need a cane, all right? So there's a good alternative here. Then, of course, medication, the medicine, for pain, the simple Panadol, all right? Then, of course, we find that sometimes Panadol doesn't work. We need to use stronger medicine. The old-fashioned things would be like Ponstan and indomethacin, but the problem with those is that you need to take it 3 times a day. That's number one. Number two, they give a lot of irritation to the stomach, gastric irritation, so you have to eat more to prevent hunger pangs, and you put on weight, and it becomes a vicious cycle. So we move away from those, and they have new medication like Celebrex and Alcoxium, which are actually formulated to have less irritation on the stomach. But however, they still have the same effect on the heart and the same effect on the kidneys, so you do not want to overdose on pain medicine. You understand what I'm trying to say? Okay, you take it when absolutely necessary, but it's not something like you want to pop in as though you're chewing, candies or something like that. Okay, now this is an area you're talking about, supplements where there's no side effects of medication, and yet it helps you. And we know, glucosamine is very helpful. The dosage is 1,500 milligrams a day for glucosamine, and you add in a chondroitin sulfate, that's 1,002. And the product is usually made on the whole from shellfish. So for those who are allergic to seafood and shellfish, or because of dietary and religious consideration, they do not want to touch that, then there's a vegetarian origin, which is shown in the picture here. All right, and then if that doesn't work, the next thing we can do is to supplement the cartilage by injecting hyaluronic acid. In the old days, we used to give HNL, which is actually a steroid, but we don't like to give too much steroids because you worry about the side effects of steroids and osteoporosis and so on. Nowadays, we have hyaluronic acid, and like over here, the different brands, it doesn't matter, is actually is a component, hyaluronic acid is a component of cartilage. We know that when we grow older, the osteoarthritis, the cartilage lose a certain amount of hyaluronic acid, and that's why they become less shock absorbing than before when you're young. So by injecting it, the cartilage in the body, the joint absorbs this and kind of like, like a sponge, it absorbs the water and you kind of, retain the, that sponginess in the sponge. So that's the whole principle of hyaluronic acid, okay? But however, it has to work when there is still cartilage left. If there's no more cartilage, then there's nothing to absorb. It's just like a sponge. If you use it after a month, it's not going to absorb any water, whereas you use it for a week. Yes, if you put in water, you can retain its sponginess. So all depends, again, on the state of arthritis that you have and how is your cartilage, in your joints. Now, if all that fails, in other words, after you take the medicine, you reduce your weight, your physiotherapy, supplements, if it doesn't work, then of course we have to consider surgery. The first surgery you do nowadays is that we try to make it as simple, as easy as possible. And this is what you call an arthroscopic surgery. This is my patient that I'm operating here. This is the knee joint, and we just put a scope here and operating device over there, just two small holes, about half a cm or 1 cm, in diameter, in length, and probe it in, and from there we can do all the surgery which I'll explain. And this is less painful, less morbidity. You don't need to stay in hospital. You can go home the same day if you wish. All right, so this is arthroscopic surgery. This is what we can do. I'll go in detail. All right, for example, that sometimes people get, piece of the cartilage breaks off. You get a loose body. If that happens, your knee will jam. You have a lot of pain. And by a simple operation, we can remove that, and you're back to normal again. Okay, so this is a loose body. This is a problem that, where meniscus is torn. It's seen in sportsmen like Fandi Ahmad. But in older people, you don't need to play football to tear you. For example, let's say you walk and you suddenly, trip over the ledge over there. You twist your knee. In an older person in the 60s and 70s, a simple, trip like that, stepping over the ledge there can tear the meniscus because they are degenerate. And if they are not treated properly, they continue to irritate the joint, cause a lot of pain, and locking the knee joint. So you need treatment in those circumstances. Of course, if you have arthritis, sometimes people with gout, when they take too much beans and so on, the knee joint flies up with gout. If you take medicine, doesn't work, we can put in a scope and it clean up all this. These are all the uric acid crystal in his synovium, and we just put it in just like the grass cutter. Of course it's miniaturized. Just go in and cut all that inflammation up in the joints. Okay, so again, all through keyhole surgery, patient is much better then. All right, now this is an interesting man. He's about 38 years old. He has a lot of pain in his knee, and his x-rays looks normal, but sometimes that's why we need to do a scan to do an MRI, and the MRI shows that, hey, this is normal, but MRI shows that actually he has a problem down here, and we call this osteochondritis dissecans, where the cartilage in the bone died. And what actually happened, this is the MRI picture. This is what happens when we do keyhole surgery. You can see the cartilage is broken, it flapped off. So it's a flapping in the joint, and it catches and causes a lot of pain, and that's why he was suffering. And x-rays didn't show it because cartilage injuries are not shown on x-rays, being shown on MRI, and we do the scope. So what do? Well, we remove all the torn part, which is dead, and then we puncture holes. We call this a microfracture. We puncture hole into the bone so that there is bleeding from the bone marrow. This end of the bone is kept by a cortical bone. When you puncture holes in it, there's bleeding from the bone marrow, which will bring out stem cells to help to regrow the cartilage. Then, of course, nowadays, these are the holes made to prevent the bone marrow bleeding from escaping into the joint and swim all over. We can use a membrane made of hyaluronic acid, and we stick it down there so it acts like a filter plate paper or blotting paper to trap all the stem cells so that they remain here and they repopulate the defect in the joint. So in other words, you get new cartilage cells. All right, but this is, however, is useful only if you have a smaller area. It's not good when you have diffuse or extensive arthritis. because it's not going to work. And it's not going to work in a person in the 70s, 60s, and 70s because the DNA are against them. There's a certain lifespan to DNA. After a certain while, the stem cells do not really work as well as when we are younger. So it's something that we want to consider in the people in the 20s, 30s, 40s, maybe even early 50. But once they're beyond 55, 60, this is not going to really work for them. So what do we do for the older patients? Well, this is another lady. She wasn't that old at the time. She was 38 years old. And the close-up of her knee shows that this part is dead. This part of the bone is arthritic. The rest is normal. But she's bow-legged. All right. We know that when people are bow-legged, they transmit a lot of weight. When we are bow-legged like this, you transmit a lot of weight on the inside of the joint where it is arthritic. But if we straighten the leg by cutting the bone, we can redistribute the weight from the joint. In other words, you transfer the weight from the bad side of the knee to the good side of the knee. We relieve her pain. So this is what we did. We cut off a wedge of bone from her, all right, and then we closed it, and we straightened, and we transfer the weight from here, the bad side of the knee, to the good side of the knee, and relieve her pain. And I saw her now, it's probably about 16 years now. She's well, no problem, and walks as per normal, works as per normal. Okay, so, but when all this fails, when you are end of the road, is there a salvation for these people? Well, there is. We can replace the whole joint. And basically, joint replacement gives good pain relief to patients who are in severe pain and arthritis, and it gives good motion. They can walk, they can sit down, but they cannot run and squat. Other than that, they are more or less normal. Okay, so we do the joint replacement for these areas. This is the first patient I shown you with the severe arthritis. Basically, we recap the thigh bone and with a metal, and the lower leg bone with a metal on plastic, and then the kneecap, the patella, we also can resurface with plastic. And ours is a bionic knee, then they work normal now. Okay, so this is a lady with rheumatoid arthritis. It's a more severe arthritis. In which they are knock knee, like here, the knees are knocking each other. They are knock knee. All right, you can see that it's severe arthritis, and so I did a knee replacement on both sides for her. So this is before surgery, ugly. After surgery, beautiful, no pain. Of course, she pulled down her pants. You don't even know that she had surgery because she walks normal. She has no pain, and she's happy, and she's taller now with no deformity. All right, so it's important then. All right, so this is another lady of mine. She has rheumatoid arthritis. I see a lot of arthritis patients, what I mean? So I've seen a lot of them. She was bedridden for 12 years. She's an Indian lady. Her daughter married an American, and she moved to the U.S. So one fine day, the son-in-law visited her from the U.S. and they said, "Hey, Mom, why are you suffering? Why you been wheelchair bound for the last 12 years? You can have surgery in the U.S. Everybody has surgery." So she came in to see me. So I said, "Yep, we can do surgery for her." This is her knee. You can see under general anesthesia. We try to straighten her leg. The knee cannot be straightened because she's been in a wheelchair for 12 years. They are contracted. All right, so we have to do surgery. And this is to show you she has severe osteoporosis because she never walked for 12 years. We replace it with artificial knee joints here. All right, and that's her. She was trapped in a wheelchair for 12 years, and she got up. This is about 6 weeks after the knee replacement. She's up and walking again, so she's back to normal. All right, and this is even more challenging. This is another lady with rheumatoid arthritis. I see a lot of rheumatoid arthritis patients in my practice in Tan Tock Seng before. The fingers are completely deformed, right? You can see that. Elbows are deformed, feet are deformed, all right? And both knees are dislocated. It's completely out. The knees are dislocated. She's wheelchair bound, bed bound, for 3 years. And then not only that, the hip is dislocated from arthritis because she never walked. And her children wheel her into my room and say, "Doctor, can you make her walk?" Well, I wish I was, like in the Bible, Jesus Christ, and say, "Yeah, in the name of Jesus, rise up and walk." But, well, I'm not an apostle, so I can't do that. So I said, "Don't worry, I can do surgery." But it took me, 3 surgeries. We had to change both knees. We had to change her hip before she get up to walk with rehabilitation and physiotherapy. All right, so, yep. If a prayer can work, why not? But if it can't work, we can do with our hands and operating room, right? Now, so that's her 12 years later. So you can see her knee, the scar there. You can see her fingers. So it's the same patient. Now she can stand and she can sit. She's back to normal. Now, I have another patient. Now, this is the reverse. This patient is a young man. He is about 33, 34. When he was in the army, he every day has back pain. And of course, you know, some bad stories about army doctors, can't talk about them. They say, oh, nothing, nothing, nothing. So for 8 to 12 years, he suffered a back pain. Eventually, his back pain is so severe is because he has this condition called ankylosing spondylitis, in which there's inflammation of all the joints in the spine. And the spine is all fused. It's completely stiff. And he has spread onto the hips, so the hips are completely stiff. So this poor man, he is not able to sit. He actually has to walk on tiptoes because his hips are stiff. He can't move. All right? But he has no pain. And he falls literally into bed because there's no hip movement. So he says, doctor, can you make me sit? So one person wants me make me walk, and another person says, can you make me sit? All right, so I said, don't worry, yes, we can do it. We take down the hip, we do hip replacement on one side, we do hip replacement on the other side, and that's him. 12 years later, you can see his back is completely stiff, but he's able to squat. From a man who cannot even sit, he can now squat. So in other words, yes, we can help patients with such severe arthritis. All right, we can do it in the shoulder as well, so you know, not all joints are replaceable. Also in the elbow, this is a patient with arthritis in the elbow, or even fractures. Nowadays, if you're dealing with, let's say this patient is 75, 80 years old, severe osteoporosis, the bone are very weak, we try not to waste our time putting plates and screws because we know the plate and screw won't hold them. We will straight away and replace it with an elbow replacement and they're back to normal. Okay, so in other words, where you know old technology, it doesn't work, new technology can overcome what the old cannot do. All right, so there are advances in surgery as in all things, all right? So if you have an arthritis just affecting only one side of the joint, the other side is okay. In the old days, we need to make a big incision like this, open up 20 cm. But nowadays, you know, this is a patient with just arthritis on one side, the other side is good. We just make a small incision on the side here, 6 cm long, all right? Okay, and then we replaced it. They are fine. And the reason why we're changing to a small incision is because in a standard incision, doing a standard total knee, this is how much they can squat. All right, you know, it's a 3/4 squat. They can sit, they can walk, they can climb stairs normal, but they can't squat in the toilet if they need to. All right, but Singapore, luckily, HDB, no more squatting toilets. All right, we got to thank our, you know, Minister of Housing Development, so on, okay, for a good job. But this is the same lady after, you know, a uni compartment. They can squat. They can go to China and visit their relatives and squat down in the village toilet. So that's fine. Okay. Now, of course, with the, you know, certain customs, they need to pray and so on. They need to squat. That is also very helpful. Okay. So the other thing is this, how long can these implants last? Usually, they traditionally last about 15 to 20 years. But right now, if you have to do a younger patient, we worry. Of course, what we can do is to change from a cobalt chrome surface, and this is called oxenium. It is much lower coefficient of friction, and hopefully it will last longer in these patients. All right. Then the other thing is, of course, people like to bend more, and so design has been changed so that it will allow more and more flexion. In some patients, not in all, okay, I can get them to bend up to 140 degrees, but to really squat, you need to bend to 155. And I don't think we, in Singapore, our lifestyle require that. If you are Korean, if you are Japanese, then you need to sit down every day. Okay, then you need to do that. Is that all right? Okay, so that's for high flexion total knee. This is all improvement in terms of the, you know, implants available from the surgical companies. The surgical techniques have changed, you know, and the physiotherapy regime, and also the anesthesia part. Nowadays, in the old days, they used to need to stay in hospital for a week. Now they can stay in, after 3 nights, they can go home on the 4th day, no problem. They can walk well and so on because of the pain management that now is available. Okay, so this is, again, as we showed, how we achieve that because the surgical companies and so on have devised new kind of instrumentation that are much smaller and they allow us to do procedure through a smaller wound. All right, rather than a bigger wound. And the next thing is that because if it's a smaller wound, all right, you need to have better visualization. Sometimes for the younger surgeons, they're not able to see so well in terms of understanding the anatomy, because they need to do a bigger incision for us. We have done it so many times, we can do surgery with our eyes closed. But for the younger boys, and especially for teaching them, because I'm involved in a lot of teaching, is that we like to use a computer. We like to use a computer to tell them, so that with a computer we can put trackers onto the bone. They will know exactly how many degrees they're cutting and how, whether it's right or wrong and so on. And this is all done with the computer simulation at the time of surgery, so it helps the younger surgeon. We can teach them better. We help them in their, the performance of surgery, so they can achieve a good result as us, who have much more experience in them. So this is part of the training legacy that we have to teach the next generation. As PM Lee says, you have to think about the 4th generation leaders. As doctors, we also have to think about our younger boys and girls after us, so that they can train and look after the next generation of population. All right, so that's computer surgery. Then, of course, there's a lot of talk, robot, in certain things like, like prostate cancer, they use robotic surgery. So, in orthopedics also we have robotic surgery. And mainly the purpose of a robot is they integrate the use of a computer over here, and we use X-rays or CT scans or MRI of the joint, and then we compute it onto the computer, and then the robot helps us in our surgery. There are 2 kinds of robot. This is the RoboDoc, which is actually originally American technology, but somehow was bought over by a Korean company, and it's called RoboDoc. Then this is still an American company, Macroplasty. So this one, the robot does the surgery itself. It's automatic. In this one, it is, the surgeon has to be around to move the robot. But the robot is programmed such that there are, limitation. It will not go beyond a certain depth or a certain angle, so that the surgeon, would not go beyond what he's supposed to do. So there's 2 kinds of robots, and so this helps in the surgery. But is it actually necessary to have a robot? Again, it's not necessary, but if somebody wants it, we can do it for them. But of course, the cost goes up. So it all depends on your insurance scheme. All right, so with that, I thank you for your time and spending the afternoon with us. If there are any questions, I'll be happy to speak to you all. Any questions from the floor?
Any questions for Dr. Lai? Actually, doctor, I have a written question here.
Okay, sure.
It was given earlier. If diagnosed with osteoarthritis of the knee, will exercise help to improve the knee and avoid surgery? What type of exercises is recommended?
Yes, I think that's a very good question. For osteoarthritis of the knee, as I said before, it is many grades. Most of the time, you feel it when it's at the beginning, all right? We are nowadays much more sensitive to pain and so on, not like the old days, or our parents' days, our grandparents' days, where they just ignored it. But nowadays, when we have started pain and so on, you diagnose yourself, you see a GP, a doctor specialist, and diagnose osteoarthritis. So usually it's in early phase, and exercise is important, as I said. Why? Because when you have pain, within 2 weeks of pain in the knee joint, the muscles around the knee actually becomes much weaker. And that actually makes the pain worse because of the weaker muscle. They can't control the knee so well, and the pain becomes much worse. So that's why physiotherapy to strengthen it is very important. The very simple exercise is actually, number 1, avoiding certain things like squatting, avoiding climbing stairs like here, because you bend to do a lot. The other thing is the simple exercises you can do for yourself. You sit in the chair, all right, 90 degrees, you just straighten your knee and keep it straight, and you bend it, all right? This exercise actually strengthens the muscle more so on the inside of the knee. It's a muscle which we call the VMO, and it strengthens this muscle. It corrects the tilt of the patella, and that improves your pain tremendously and helps you in your walking and, and your daily activities. That's number 1. Number 2, what kind of sports you can do? Well, I would recommend that you walk. Best is flat road rather than incline or, Bukit Timah Hill. Avoid running because it makes the arthritis worse. Swimming is good. Cycling is good. And then the other one in the gym is the elliptical cross trainer. Don't pound on the treadmill. That's bad for you. You can walk, that's fine, keep it flat. But the elliptical cross trainer, the one that you have the two handles, and then it's either go backward and forward on the legs, or it goes in a elliptical circle. That is very good because there's no impact on your knees. All right?
Thank you, Doc. Do we have any more questions for Dr. Lai?
Yes.
Doctor, may I know, does frequent cycling weaken the two knee joints here?
Sorry?
Frequent cycling weaken...
No, cycling doesn't. In fact, cycling strengthens your knee.
Thank you.
All right, strengthen the knee muscle is helpful. And it's not, there's no impact on it. You know, it's a very low impact activity. You're not running on it. So it's good for your joints.
We have...
I understand when you swim, freestyle is better than breaststroke. Breaststroke will make the knee worse.
Oh, yes. It all depends on the type of arthritis you have. On the whole, freestyle is good because when you kick the freestyle, it is up and down. It's about 30 degrees of flexion in the hip and knee. It's fine. It's good both for the hip and the knee. In the breaststroke, if you do it properly, you're not doing the improper stroke. If you do it the Olympic style, you have to deep flexion of the hip. Then you have to abduct, open up the hip and kick it out. That is very bad for the hip, all right? Because some people may have problems in the hip that causes that. With the knee, it's not, that bad, but it causes a lot of problem for the back of the spine because of the twisting. So in terms of patients with arthritis of hip and knee, freestyle, if they can swim it, it's very, very good. Or backstroke on the other side is very good. Butterfly is not bad, but it's very hard to swim butterfly. Very few of us can swim butterfly unless Joseph Schooling or Michael Phelps. But freestyle is good. But some people can't, then they do breaststroke. So we tell them to be careful. Don't be too Olympic style technique. Cheat a little bit, less hip leg abduction and so on. That helps. Okay. Yes. Okay, wearing high heels, it's bad for the feet. It is bad for the back, all right? It depends on how high. If you have a certain problem in the knee, it may give you problem, but on the whole, it has not so much effect on the knees, more on the feet and the back, not so much on the knee. But of course, it depends on how many inches. You're talking about 6 inches. All right.
Dr. Lai?
Yes.
Yeah.
Yes.
The cross trainer is good for the knees, but is it good for the back or does it do
Yes,
injury?
it's good for the back too because you have to keep straight and you have to use arm. You have to maintain it straight. Actually, the elliptical cross trainer is a pretty good exercise to maintain health and strength of the muscles, and also it's good for your heart as well.
Okay. Can I ask another question?
Yes, sure, please.
What is the exercise for people with that kind of fingers?
Oh, yeah, when you have severe, those form of arthritis is very, very severe. It's not your the little, some people have what you call, older people, they have it in the distal joint. They're not like hers. Hers is in rheumatoid arthritis. For those in which it's just your fingers, it's just your activities of daily living, you take glucosamine supplements and you massage heat. You find you're more stiff early in the morning, so you keep it warm and so on. It helps a lot. All right. So, but those are different. Those severe rheumatoid arthritis, where the joints are eaten up by the disease process and they're all dislocated, all mangled up. Then, of course, they are not so worried about exercises, but they're talking about modification of their eating styles, like certain equipment, day-to-day living modification is important to help them. Like opening doors and jars. It may be even a problem for such people with severe arthritis.
So these type of fingers, they are not osteoarthritis?
In that one is rheumatoid. If yours is just osteoarthritis, not to worry too much. It looks a bit ugly, but it's not that problematic. Okay. I don't really talk about spine today. Spine operation, it all depends on what you are doing, Not necessarily. Not necessarily. It all depends on what is your problem. Well, you have to be careful. You have to be careful. You cannot, pick a big hammer. You need a microscope and so on. Oh, yes, of course. Yeah. You need someone who's experienced in it, someone who uses a microscope, someone who evaluates. In other words, basically, everything is number one, you have to see a doctor who will evaluate your problem properly, listening to you, examining you, get the necessary investigations, and then plan with you what is needed to be done, and walk through you all the risks and problems. So, it's not necessarily dangerous in the sense that it's, like asking you to go a combat suicide mission, that kind of, like flying the Twin Towers. That's absolutely dangerous, right? Those guys who flew the plane in September 11, the Twin Towers, absolutely dangerous, 100% death, because that's what they want to do. But, surgery, you plan and so on, it's pretty safe, but it has to be well controlled and qualified, okay?
I have a question,
Yes.
Dr. Lai. After the surgery of total replacement, when I try to do the cycling, it's painful.
Well, okay, so the thing is that firstly, you need to have a graduated program. I'm sure your doctor or your physiotherapist will walk through with you. First is range of motions, extension, then bending to at least 90, then get the strength in. After that, then you slowly cycle to get the motion in. So instead of starting straight away on the exercise bike, they have a little cycling on the floor that you can cycle, which is less range of motion that helps you. But you need to work it out. It's not just like, if you have this, you do that. You need to work with your doctor and your physiotherapist.
We have one last question, Dr. Lai.
Yes.
Hi, Dr. Lai. Good afternoon. Okay, I got one question concerning spine.
Yes.
Recently, I came across one machine that has been in the market for quite some time, whereby we lie down on the bed, and then they try and massage the spine from the hip up to the neck. I don't know whether you've heard of this kind of bed. It's actually from Korea. Apparently, a lot of elderly people are going there on a very regular basis, and it seems it helps.
Well, I think various form of massages are helpful because it releases.
It's a bed. It's a metal bed.
Yeah. It's just like a chair and so on. They're massaging. They're helpful. So in the bed, the problem with the chair is that as the massager go down your back, you can, bend forward and so on. Whereas in the bed, you are flat, so you can't, move away from the massager. So it all depends on the type of condition. But if it's mainly just a ligamentous backache and so on, rather than a nerve problem and so on, those do help. Physiotherapy, massages do help. But everything has to depends on the type of problem. So it doesn't mean your back problem, everything is this or that. It's all depending what kind of back problem, because a lot of things can go wrong in the back. With the back, can be a nerve problem, can be a spinal cord problem, can be a tumor, can be a fracture, can be arthritis, can be a ligament or muscle problem. So you need to know where is your problem. All right. So in other words, basically, it's diagnosis. You need to know what it is before you can treat it.
Thank you, Dr. Lai. For those of you who want to ask more questions later, maybe you can ask Dr. Lai later. Dr. Lai, we just want to present this simple token for you. Please let us give a hand to Dr.
Thank you
Lai.
very much. So let me give you back this thing.